Fellow Gambians and residents, each year on the 1st December, the world commemorates World AIDS Day to mark the pivotal impact communities have had in shaping the HIV response, as well as global health at large. World AIDS Day is an opportunity to reflect on the progress made to date, raise awareness about the challenges that remain to achieve the goals of ending AIDS by 2030, and mobilize all stakeholders to jointly redouble efforts to ensure a successful HIV response. This annual event serves as a reminder of the global struggle to end HIV-related stigma, an opportunity to honor those we have lost, and a rallying cry to continue working towards a day when HIV will no longer be a public health threat. Through remembrance, we draw strength, inspiration, and determination to redouble our efforts in fighting the disease and providing support to those with HIV. It's time to remind ourselves of the importance of compassion, empathy, and solidarity in the face of adversity. The progress we made in the HIV response was possible by the coming together of various stakeholders such as governments, the community, civil society, advocates, activists, the faith-based organizations, and public and private organizations in order to achieve the shared goal of saving precious lives, leaving no one behind in changing the course of the HIV pandemic. Fellow Gambians, each World AIDS Day focuses on a specific theme, and this year's theme is overcoming disruption, transforming the AIDS response. This theme is relevant in the light of the current challenging funding landscape. In 2025, a historic funding crisis threatened to unravel decades of progress achieved. HIV prevention services are severely disrupted. Community-led services vital to reaching marginalized populations are being deprioritized, while the rise in key population hostile policies are making HIV services inaccessible. It is an important opportunity to highlight the impact that the funding cuts from international donors have had on the response to AIDS, as well as to showcase the resilience of countries and communities setting up to protect the gains made and drive the HIV response forward. The global AIDS response has been upended in recent months, but there is still much more to be done to achieve the SDG target of ending AIDS by 2030. AIDS is not over, and given today's environment, a new transformative approach is needed to mitigate risk and help usher in progress and help us reach our targets. Countries must make radical shifts to HIV programming and funding. The global HIV response cannot rely on domestic resources alone. But as we have just learned, relying heavily on external resources to service the response can be risky. The international community must come together to bridge the financial gap, support countries to close the remaining gaps in HIV prevention and treatment services, remove legal and social barriers, and empower communities to lead the way forward as HIV knows no boundaries. We recognize that political leadership is paramount in advancing policies that address structural inequalities and protect vulnerable populations. Transformative solutions are needed to improve access to HIV services, eliminate stigma and discrimination once and for all, and ensure the protection of the rights of women, girls, and key populations who continue to face disproportionate barriers in accessing healthcare. In a time of crisis, the world must choose transformation over retreat, said Ms. Buyanyima. Together, we can still end AIDS as a public health threat by 2030 if we act with urgency, unity, and unwavering commitment. Fellow Gambians, this World AIDS Day enjoins us in calling for sustained political leadership, international cooperation, and human rights-centered approaches to end AIDS by 2030. This year's World AIDS Day is a global moment to reflect upon, recommit, and act swiftly so that no one is left behind. Today, scientific advances have been made in HIV treatment with the advent and availability of highly effective antiretrovirals that suppress the virus that causes AIDS. Despite these achievements, many new infections occur each year. A good number of people still do not know how to protect themselves. Stigma and discrimination remain a reality for many people living with HIV. As of 2025, there are 39 million people living with HIV globally, and by the end of 2024, 77% of people living with HIV were on life-saving antiretroviral therapy, 72% of whom were virally suppressed. The impact of these successes can be seen in the 40% reduction in new HIV infections and 54% reduction in AIDS-related deaths since 2010. Additionally, 4.4 million children have been saved from acquiring HIV since 2000. In 2024, 75,000 children were born with HIV, which is 65% drop from the 2010 figure. In our beloved homeland, the Gambia, in 2024, out of the estimated 25,247 people living with HIV, 16,071, that's 64%, knew their HIV status, 11,187, that's 70%, of whom were on antiretroviral treatment. Of those on antiretroviral treatment, 8,807, that's 79%, attained viral suppression. By viral suppression, we mean the infected person can no longer infect another person. People living with HIV who take antiretroviral medications as prescribed and who achieved viral suppression and then maintain an undetectable viral load have effectively no risk of sexually transmitting the virus to others. HIV responses succeed when they are anchored in strong collaboration to follow the evidence, to tackle the inequities, holding back progress, to enable communities and civil society organizations play their vital roles in the response, and to ensure sufficient and sustainable funding. In conclusion, I therefore urge each and every one of us to show solidarity, resilience, and sustained efforts and compassion towards those already infected and or affected by HIV, while endeavoring to end funding inequalities so as to smoothen our collective strive to end AIDS and eventually end the pandemic. I thank you all for your kind attention.